Well, good evening, everyone. I was just waiting for people to enter. Um, Welcome back to the Canadian Concussion Center's webinar series, which is sponsored by by LIUNA, the Labor's International Union of North America. If you've been here before, you know my name is Leslie Rattan, and I'm really pleased to be moderating our series, which was developed for individuals that have suffered concussion, their family, caregivers, as well as healthcare providers. And if you've been here before, you'll know that we usually start with an expert speaker who presents on something related to concussion. And then the second half of the evening is allotted to question and answer period. So this is where you can get your questions answered. Just if you look at the bottom of your screen, you should see both a Q&A and a chat function. If you're having any technical difficulties, please enter any questions that you have into the chat, and Christian will help you out. If you have any questions for our speaker tonight, please enter those into the Q&A. Also, just so you know, we have been running this series for a while now, and all of our presentations are archived and available on the Canadian Concussion Center's website. So if you want to go back and watch any of those, you can see them. Just before I proceed any further, I'm just going to have Christian, we're just going to run a short poll just to get a sense of who is in our audience. And thank you, Christian. He's also put the link to the Canadian Concussion Center website into the chat. Okay. So for this evening's session, I'm really happy, pleased to welcome back Dr. Nick Reed, who's going to be presenting on return to school and learning, or returning to learn after concussion. And Nick is an associate professor in the Department of Occupational Science and Occupational Therapy at the University of Toronto, where he is the director of the Oak Concussion Lab and holds a Canada Research Chair, Tier 2 in pediatric concussion. His work focuses on research, educational, and clinical programming, specific to youth and concussion. And with that, I'm going to turn it over to Dr. Reed.
Fantastic. Thank you so much, Leslie, for the introduction and for having me out this evening to share on returning to learn after concussion. I'm thrilled to be here with all of you, and I've crammed a lot of information into this talk, but hopefully we do save some good time for discussion. I know that's a big part of this webinar series, and I think a really important one. So we will make sure we save time for some Q&A and some discussion. I just want to mention as well, really thrilled to be here this evening during this week, which is Concussion Awareness Week across the country. You can check out hashtag Concussion Awareness Week for any of you social media users. There's a ton of great resources being shared right now, so I highly encourage you to do that. And excited to be sharing this information with all of you tonight. So thank you. Let's dive in. So just some disclosures. You heard some in my introduction and some of my funding bodies, and just also mentioning my involvement with a research study funded by the National Football League, and that I'm a minority shareholder in 360 Concussion Care, an interdisciplinary concussion clinic. So just giving you a bit of background on who I am. I'm an occupational therapist by clinical training. And thrilled to be one. I'm very proud of this profession and our focus on enabling or helping individuals and communities do the things they need, want, and love to do. And that's what I try to do in my practice, working with youth and their families who have experienced concussion. My career as a researcher began at Holland Bloorview Kids Rehabilitation Hospital. And it also allowed me to practice my trade clinically, so to support young people and their families to return to those activities that they need, want, and love to do after concussion. And I continue to be able to support clinical initiatives through 360 Concussion Care, where I act as the lead for our knowledge translation arm. As Leslie mentioned, at the University of Toronto, I direct the OAK Concussion Lab. OAK standing for Outcomes, Advocacy, and Knowledge. And this gives us an opportunity to dream up and execute a range of different projects, all designed to helping young people learn more about concussion and manage that injury when they have it. And I'm fortunate enough to be supported by the Canada Research Chairs program, holding a Tier 2 Canada Research Chair in pediatric concussion. So that's a bit about me. What are we going to talk about this evening? Well, a few areas. First, I want to just get on my soapbox that I like to get on around this idea of managing concussion and really helping us reorient to this idea of focusing on function and not just the symptoms that come with concussion, but how do those symptoms impact what we can and can't do in our lives, including returning to school for many youth. I'll touch a little bit on some law here in Ontario, so Rowans Law, as well as some evidence and some tools to implement and share that evidence that I'm hopeful that you can all access and take a look at, and hopefully can help you and those in your lives better manage this injury. I'll touch on a few strategies that I like to think can help with returning to school after concussion. And if nothing else, at the end, we'll have some take-home points. And I'll just say there's a whole lot of links and resources along the way. This is going to be a bit fast and furious. However, I'm hopeful that these slides will be shared if they haven't already been so in the chat. And the hyperlinks are all the links that I mentioned in the presentation are all hyperlinked in that document. So you can go check out these different resources and see what resonates best for you. So, okay, now we have a bit of a plan mapped out. Let's dive in and first start with this idea of a focus on function when it comes to concussion care. So this idea that it's not only about symptoms, and I like to frame this with an example here of a young man. This is Josh, who had a concussion. And when Josh had his concussion, the symptoms that were really bothering him were regular headaches, some dizziness. He had some anxiety around re-engaging in his activities, and certainly some attention deficit or difficulty in the classroom in particular. So these were the symptoms that Josh was telling us all about. But I think what we want to really focus on when we're aiming to help Josh get back to life is, how do these symptoms impact the things that matter to him? And the things that, when I asked him, what are the things in your life that you need, want, and love to do? He, like many young people, had a range of things that were important to him: sports, going to school. He was trying to learn how to drive that family minivan, and also just hanging out with his friends and doing things like jumping on this trampoline. So Josh's life is full of lots of different activities that get him excited. And we want to focus on those when we're managing concussion. So this idea, just to sort of plant the seed as we talk about things today, that, this idea of focusing on function and what Josh needs, wants, and loves to do, including return to school, can be a really great way to approach recovery and management, not just from a healthcare standpoint, but from a family standpoint and from a peer support or social support standpoint. Let's really try to tap into what do people need and help them do that. So for Josh and for many young people, returning to school after concussion is a real challenge. And as I'm talking about this today, I like to situate it in this biopsychosocial model where, this interaction between the biology, so the injury itself, the social nature of one's life, so family, friends, relationships, that culture or environment of the school, and the psychological components that are playing many factors influencing recovery and just how people feel about themselves. So that sort of intersection of all of these is that optimal health and perhaps optimal returning to school when we talk about it in today's context. So I just want you all, as we begin here, to reflect a little bit on what was or is school like for you. What kind of environment was that? What kind of demands were there? So from a demand standpoint, we have a daily schedule, there's deadlines, there's pressure coming from all different places. There's lots of activities. Typically, it's a busy day, depending on what grade you're in and what level of school and that school schedule. But generally, there's a lot of different things that a young person is responsible for, both active and passive. often group-based activities and often risky activities where, you know, perhaps you could get hit again and hurt your head or hurt anywhere else in your body. And we want to try to avoid that during a recovery process after a concussion. A big piece that I tend to focus on when I talk about returning to learn after concussion is that environmental component. So school is often very busy, very noisy. Young people are rarely alone or have that chance to kind of recharge in a quiet place on their own. Just an example I like to always ask kids when I'm helping them try to get back to school is, you know, where do you eat lunch? And they generally say in the cafeteria. And I say, how does that go usually? And they say it's very noisy and busy and hard to focus and recharge. So just things like that, keeping these different factors in mind, this is all going to influence that return to school process and how well it goes for a young person after a concussion. You know, from the literature, and there's more literature being produced on this at a regular pace, and I'll tell you a bit more about that when we talk about the evidence. But this paper by Carol DiMatteo at McMaster and colleagues from 2019 just really shows that a lot of young people with concussion are having academic difficulties, and not just during their concussion recovery when they have symptoms and they're still in that recovery phase, but also once those symptoms go away, right? And that could be a product of being behind or having extra work put on you, or just having new approaches to learning that you're managing after that concussion experience. So bottom line is school is very important to young people. And these young people need help to get back to a pace and an environment and a level of productivity that they want to. Okay, so that was a bit on sort of this idea of focusing on function. Let's talk a little bit about some of the facilitators and the evidence here in Ontario and beyond. So what does the law say? And just letting folks know, if you haven't already heard of this law, Rowans Law is Ontario's concussion legislation or law that was named in memory of Rowan Stringer. I'll just bring your attention to Rowan's story. We don't have time to go into it too much tonight, but just highlighting a few links. This one in particular that I put a blue box around, I highly encourage you to check it out. This speaks to Rowan's father, Gord, who has been a true champion to make sure that what happened to his daughter doesn't happen to others. So highly encourage you to check that out. And I also mention this because tomorrow is Rowans Law Day across Ontario. So the timing of this talk couldn't be more aligned. And Rowans Law Day is designed to commemorate Rowan's story and to really raise awareness around concussion across sectors, be it education sector, sport community, and beyond. So I highly encourage you to get involved tomorrow. And that is Wednesday, September 27th, in case people are looking at recordings on this. Check out some information on the Ontario government's website. Here, there's a link. But also for social media users, the hashtag Rowans Law Day is usually really active on this day. So tomorrow, check that out and see what's going on out there and join that conversation and contribute to the awareness building across the province and country. So when it comes to Rowans Law, so there's alignment, direct alignment with the Ministry of Education's concussion policy, or PPM 158, that is giving guidance to school boards across Ontario on what needs to be done with respect to concussion within the school system. And just a quick overview of this, there's a concussion code of conduct that's part of that. So all young people signing a code of conduct on how they will respect themselves and others. There's a process for removing students with a suspected concussion from physical activity, along with a return to school plan that's incorporated into that to help support that child or that young person get back to the school environment. And it's a process to document and track a student's progress. There are a range of concussion awareness resources that I put a link in the slide deck, and you can see it here as well, that all schools across Ontario are meant to use to share this information, which is a huge facilitator that we have here in Ontario to support this process. Okay, so that's the law. What does the evidence say when it comes to returning to learn after concussion? And I'm going to direct our attention to two. I'll be totally transparent. I have a bias. I co-lead our PEDS Concussion Living Guideline with my fantastic colleague, Dr. Roger Zemek, out in Ottawa, and also an amazing team of about 45 experts from across North America. And there's also a fantastic adult guideline as well, led by Sean Marshall, also out in Ottawa. And these clinical practice guidelines are living, meaning they're never out of date. There's always continuous review of the literature, and they put all of the evidence into practice with clinical practice guidelines and resources and tools that can be used by healthcare professionals, but also all of us in the general public as well, to help guide how do we manage this injury and what steps can we take. So I highly encourage you to take a look at both of these documents. Today, we're going to focus on the pediatric side. And I just want to give you a little bit of an overview on this document itself, on this platform, just to give you a sense of what it's all about and how it may be beneficial for you in your own world. So I mentioned this idea of a living guideline. And again, this means we're doing a bi-monthly literature search. So looking at all pediatric concussion literature that's produced, and there's more and more being produced every month, which is fantastic. Just means a lot of work for us as a team to review the information, but we're happy to do that work to get it into practice quickly. There's article review and screening. We decide which papers can be included based on inclusion criteria. And then we engage a great team of pediatric concussion experts from across North America who discuss and battle it out and are a little bit critical around how do we take that evidence and put it into a recommendation that makes sense for the general public to use. So it's quite the process. Just some major updates that have been happening. If we do make major updates, we engage our 47 experts from across North America. We need 75% of panel members to be a part of that vote on our recommendations that are created. So that's our quorum, and we need 75% consensus across these experts in order to make a change in that guideline. So just acknowledging the sort of the process that we take to ensure that the recommendations are ones that we really can believe in and share broadly. So you can find out lots more on how we do this at our pedsconcussion.com website. So when it comes to returning to learn after concussion, we do have some specific clinical practice recommendations based on all of the evidence ever produced on pediatric concussion. And I'll share a few of those with you today. So this idea that we want to encourage youth after a concussion to get moving again, to get back into the classroom, and not be in what we used to call, and still call, but used to use more often than we do now, bedroom jail. So sort of removed from cognitive stimulation, from physical activity, from social engagement for very long. So this recommendation of about 24 to 48 hours of good rest, because we're going to need it, but then to re-engage into all activities that are safe in a stepwise and gradual way, and I'll talk about that a little bit more as we go along, is really, really encouraged. With all that said, it's not as easy as just getting back into the school environment, being dropped off and getting into the classroom. We do need to work together, parents, teachers, the student, to really create some accommodations and adaptations to that school environment to benefit the student most. And I have some slides on that as well. This idea of a stepwise return to school plan is essential, as well as accommodations based on that student's needs. And also, when it comes to these accommodations and plans, we want to monitor and modify these with the school being heavily involved in that, because needs will change. And sometimes they change in a linear fashion, meaning we can remove accommodations from the school environment. But sometimes we go backwards a little bit, and that's just the nature of concussion recovery. And we want to be able to reintegrate some of these accommodations and supports as needed. Just, this is a bit overwhelming to see all these links hyperlinked, but I wanted to make sure you had them in your deck, because these are all the tools related to this recommendation in the guideline that you can access to use to implement this recommendation. So this idea of stepwise return to school plans, well, we have a tool for that, or some templates to help support school discussions and point people to help those students. there's some tools to support that as well. So I encourage you, when you find that free moment, I know it's hard to find those free moments, but to scan some of these tools and see which ones really resonate for you. Related, so another recommendation is around this complete absence from school environment. And really, the evidence is pushing this way, and our consensus of the experts on our team really pushing to this idea of really trying to avoid being absent from school for more than 1 week. So even if it means after that week to just get into the school environment for some social interaction and some, even for a short period of time, the evidence is really pointing towards getting back into that environment with supports and accommodations to reap those benefits and to begin to heal. This idea of temporary academic accommodations is really important, and we need schools on board to support with this, where we identify what those accommodations could be. And they're not forever, but they're for as long as that student needs them, based on their concussion symptoms and how that recovery is progressing. Also, another recommendation related to returning to school is around avoiding school activities associated with risk or contact. So this could be in phys ed class, or this could be just going into unpredictable environments in the school environment. We need to ensure that while recovering from a concussion, that our young people are not exposed to another concussion. So there could be some physical activity. There could be in sort of controlled and predictable environments, but certainly we want to avoid those unpredictable environments or risky contact activities until that recovery has taken place. Also, some tools to support these recommendations, which I recommend you take a look at. One tool we will touch on today in the time that we have together is a brand new return to school protocol that has just come out, and I'll walk you through that as best we can in the time allotted, but I encourage you to all take a look at that, and we'll make sure you have all the links to do so. Okay, so what can help? And this will be a bit fast and furious going through, but I do want to touch on first this idea of a stepwise and gradual approach to returning to the learning environment after a concussion. And as I mentioned, we do have a brand new tool to support this, which incorporates all the best and latest evidence, as well as has been voted on by our 47 expert panelists across North America to make sure the language is something that is accurate and the processes and steps within the protocol are hopefully going to be create an optimal environment for returning to activity. When I present this tool, let's keep in mind that these are just steps, right? And I know sometimes we create these protocols and we share them and we say, okay, that's it, and everyone's going to do just fine with these steps written on a piece of paper. I know what I'm going to say is we need to challenge ourselves, whether it's in the school environment or family dynamic or healthcare professionals, to figure out the best strategies for that child to bring these protocols to life. That's where the magic can really happen. But we need to put our heads together to do that and all be working together. Okay, so let's walk through these return to learn, return to school steps. What I'll say, this is the document that you can access via download on the pedsconcussion.com website. There's some instructions that go along with these stages, and we were quite intentional as a working group to make these instructions hopefully quite clear to help people walk through these steps. And if we think about these instructions, we really want to be thinking about this idea of a gradual increase in the school environment of activities, that return to school should not be restricted if the student is tolerating full days. So if they're doing quite well, we don't need to hold them back. And that progression through this strategy may be slowed when there are some significant symptoms that are exacerbating or making this the ability to function in the school environment worse. Also, we have some definitions as part of this return to learn protocol, just to make sure that some of the language used that's been adapted from our most recent international consensus on concussion in sport, just to make sure that this language is understood by all end users. And one thing I'll say as well is if you're going through this document on your own and there's some things that are challenging you, we're always open for feedback. We want to make this as usable as possible. So some of these definitions I'll leave on the screen as I go through, just so you can have a reference to them. But the first step is that activities of daily living and relative rest. So this is that 24 to 48 hour period of some good rest, cognitive and physical, because the brain and body really needs it. Focusing on social interactions at home, maybe some light exercise, and not worsening those concussion symptoms. The next being, let's get into the school environment. And really working with the school, having a point person in the school to identify what those accommodations could be, to make sure that that student is best supported in that school environment. One thing I'll mention, and we wanted to make it really clear on here, is that clearance from your doctor is not required to return to low risk in-person or at-home school activities. So we want to make that clear that sometimes students will be waiting for a doctor's appointment or to get some additional information and clearance from a doctor to get in the school environment. And as long as that student is avoiding risky activities where they could have another concussion, we do want to facilitate that return to school. And again, this idea of complete absence from school beyond 1 week, based on the evidence, is not recommended. We then progress to this idea of part-time or full days in the school environment, with accommodations as needed that can be introduced and removed or reintroduced, depending on the needs of the child. But we do want to begin to gradually reduce those accommodations and increase workload until that student is engaging in full days of school activity without concussion-related accommodations. And I highlight this idea of concussion-related accommodations because many students have many different needs and have accommodations for many reasons. So we want to keep those accommodations in place, but remove the ones that were specific or unique to the concussion, should that child be recovering well and tolerating those school activities. And then the final stage here is that full return to school, with no academic accommodations related to that concussion, full days of school and academic activities. And again, a medical clearance note is not required to return to school. A caveat, it is required to return to risky activities like sports and contact sports, but we do want to facilitate kids getting back to school. With that said, we do want to make sure that there is medical oversight and support for that child. So interacting with the family doctor is still really important, and the broader health team. However, this idea of medical clearance is not necessarily required here. Okay, so what I want to touch on as well in the time that we have together tonight is this idea of the use of accommodations and supports. And again, this is where the magic happens, working together with the school, with the healthcare team, with the family of the student, and with the student themselves at the fore, to really decide what accommodations could be most useful. I like to think about these accommodations across the environment, the instruction in the classroom, as well as the assessment and evaluation in the classroom. Here's a few examples of the environment. We don't have too much time to go through all of them, but simply, thinking about preferential seating to minimize distractions, or having some breaks built into that school environment where a quiet space can be found to recharge as needed. Rather than going home, can we recharge in a quiet space and re-engage in the classroom environment? Instructionally, so helping teachers get a better sense of how to best support youth with concussion on teaching, and what are some of the best ways to share information with someone who's struggling with their concussion recovery, as well as this idea of working with teachers and schools around assessment of performance. And do we need to have multiple tests and exams for a child who's struggling after a concussion, or can we think of other ways to evaluate performance? It's really individualized, and we do need to think about this idea of adjusting. You can find this resource and others in a tool we've created over the years called School First. And hopefully you find some useful information on that website if you choose to take a look. Just a few other strategies that I like to share around supporting return to learn at school. Having a contact person, a point person in the school environment. Some of my advice to families after they've had a concussion is one of those first calls should be to the school principal or vice principal and ask the question, who in my child's school can be that point person for my child to help navigate this return? When there is a point person identified, things tend to go a whole lot better. As well as I mentioned, rest breaks, preferential seating, eating lunch in a quiet, distraction-free area with some friends, ideally, so there isn't that aspect of isolation for the child. Something I'll touch on as well is a concept that I like to use a lot in my work and is a real principle of occupational therapy around this idea of energy conservation. So I like to explain this to young people and their families using an analogy of a gas tank where, you know, our brain or our body is a gas tank. Everything we do in our day, whether it be going up a flight of stairs or listening to a teacher speaking to us or hanging out with our friends, that's going to use some of that gas in the tank. And when we have a concussion, because it is an energy crisis in the brain and body, a lot of energy is going to heal that injury. We can think of our gas tank as being half full or you know, on the way to empty. So we don't have as many resources to do the typical things we normally do. And when we hit empty, two things happen. One, our concussion symptoms tend to get worse. So our headaches might get worse, or our decreased attention may be exacerbated. And also, we just don't have a lot of energy in that tank to heal the injury. So our symptoms may be more prolonged as a result. So what we want to try to promote is this idea of identifying how much energy you have and how do we prioritize the use of that energy in the school environment. So we only have so much to use. What are we going to use it on? And then how are we going to refill that tank? So the goal is to keep that tank as full as we possibly can to feel well, to function well, and to have enough fuel in the tank to heal from this injury. So I'll just quickly go through some strategies to do that. I'll give you a link. I'll share a link where you can access all of these strategies and put them into practice. But one is the 4 Ps of energy conservation. So planning, prioritizing how we spend our energy, planning out how we're going to use it on what different activities throughout the day, and when we're going to refill that tank as well, pacing ourselves so we're not doing too much for too long at any given time, and positioning ourselves in environments that are going to be conducive to not wasting energy. Going back to that preferential seating example in the school environment, if you're sitting in the front row, you can focus on the teacher, use all your energy for that. If you're in the back row, you may be wasting some of that energy on, you know, what that person, what they got a new hat, or maybe they're texting, or, you know, all the things that go on in a regular classroom. We want to promote really good sleep. That's a great way to keep that tank full. We want to promote really great nutrition. That's another way to keep that tank full and give the body what it needs. We want to try to implement some relaxation practices to tap into in the school environment when you need them. We want to have that point person in the school with some communication and gradual increase of activities and decrease of accommodations as needed. And we want to incorporate all of this returning to school in the context of also returning to other things like physical activity and sport. And what I always speak to is we need to make sure that young people can handle the school environment, all of it. That's going to be a good sign that their brain and body are feeling well and on the way to recovery before we start getting into full sport play and contact. With that said, exercise is really important. That's going to be a great part of that recovery process, but we don't want to be putting youth into situations where they're at risk for having another concussion while they're healing from the one that they're experiencing. So here's some great links to find out more on this. A handbook through Holland Blue Review, that when I was able to work with some great people at Blue Review while at Holland Blue Review to create this handbook. And also Sunnybrook has a fantastic version of these strategies for adults and populations as well. So I encourage you to check those out. The last thing I'll touch on here around some things that can help is something that our research group is really exploring, and that is this idea of providing social support. So being a good friend to someone with a concussion, a good teammate, a good classmate, just someone they can rely on for some support in the school environment. We've done some publishing on this, so you can take a look at some of our work. And again, the links will be in the deck that you'll be provided. But bottom line here is that there are different types of social support. Emotional being that sense of social inclusion and reassurance. Tangible being direct physical support and aids, and informational, so giving advice or strategies to a peer who needs them. And we found in our work working with young people, especially in high schools, is that when they have a concussion, they really do want their friends to help them. They want their friends to share some notes with them, to maybe help them get to school as needed so they're not using too much energy, and to just keep them informed and in the loop so they're not feeling out of touch with their friend group. This can go a really long way. More to be explored in research, but encouraging all of us to just think about that. How can we support our friends in the school environment when they have a concussion? We also have some tools and resources for teachers thinking about providing that social support or that near peer support from teacher to student on how to just get these conversations started. When we talk to teachers, part of their challenge with supporting young people with concussion was just knowing how to get started, how to get over that hump, and how to best support them with some conversation. So we've created a tool that can be used by teachers, but also parents and friends can use this just to get those discussions and conversations started with their young person who's had a concussion, to find out what they really need and how we can best support them. So I encourage you to take a look. These are all freely available at schoolfirstconcussion.ca. Okay, so again, I wanted to make sure we had some good amount of time for some discussion and questions. So I think we're on target for that tonight. But I do want to end with some take-home points and a few Nick tips, I like to call them. So just some takeaways that hopefully you can start to think about a little bit more and maybe implement in your own world and networks. So the first Nick tip that I'm going to share here around return to school is this idea, and I mentioned it already, but I'll reiterate because it's really, really important, is doing what we can to find a point person at your school. And if you're listening to this and you are a school professional, you work in the education system, sort of thinking to yourself, well, who is that point person in my school? And if you don't have one, perhaps that's a discussion to have at the next faculty meeting or teachers meeting, to get a sense of how can we identify that, because the literature is clear here that this can be extremely beneficial for a young person and their family experiencing a concussion, to just have someone they can rely on in the school environment who can support them, who can give them the resources, and can be an advocate for them in that school environment, and really sort of speak on their behalf when that child may not have the ability to speak for themselves. I encourage you as a second Nick tip to use resources and tools to guide you. There is so much great stuff out there. It's just a matter of trying to find it and figure out what works best for you, for your situation and your environment. So there's a whole range of links here that I think are all fantastic tools, up to date and trusted. So I encourage you to explore and see which ones resonate most with you. And you can always reach out to me for some advice around what might be a good fit and what might be able to be put into action for you best. And then I'll close with a final tip here on just being good to yourself and to others. When it comes to recovering from concussion, there's a lot of pressure, right? It's what I like to call an invisible injury. Not everyone understands it. Not everyone cares to understand it. I think we've made some major gains in this space where people are more aware, much more supportive than we have been probably ever, which is fantastic. But at the same time, we need to be good to ourselves. If it's you experiencing a concussion and the symptoms and the functional deficits that come with it, we need to listen to our body, take steps forward, but also know that sometimes taking a step backwards or reintroducing some accommodations and supports in the school environment, that's totally okay and that's totally normal. And we need to normalize that and discuss that recovery isn't always linear. Return to learn can take time, and that's also normal. The literature has showed us that. There's a lot of young people, about 30%, that are going to experience some significant symptoms beyond a month and many months. And school is going to take a toll as well. So we want to normalize that it's not always a quick fix, and we just need to have the supports in place to be there for that student when they need us. This idea of being good to those around you, so providing that social support. If there's one takeaway from this, if there's anyone in your life or in your classroom or in your clinic that has a concussion, just maybe take a step back and think, how can I help them best? Maybe ask that exact question. What do you need from me to support you to feel well and to get back to the things that matter to you? And usually when we start with that question, we hear a lot from young people, and we can help. And also just knowing we can't do this alone. It is a team effort. Return to learn after concussion. There's a lot of players, and we all need to get on the same page, from in the school, the healthcare team, the family, and of course we need to put the student at the front of all of this, and really listen to the student and what they need in this process. A whole bunch of people to thank. So got some logos on there. I'm just so thankful to be able to conduct this work and to share this information with you tonight. So thank you to all these people that have been a part of all of these efforts to explore return to learn after concussion, as well as all things related to pediatric concussion. It's a really great community out there. We're fortunate. So thank you all. My contact information is here. If nothing else, you have a new contact in this space. Reach out to me at any time. I'd love to give you some advice as needed, or point you in the right direction depending on where you are and what you need. But huge thank you to all of you for carving out time this evening, for being a part of this, and for listening. I really appreciate it, and I'm looking forward to some discussion. So I'll leave it at that and open it up. Thank you.
Great. Thank you so much, Nick. That was fantastic, and so many excellent resources. Really appreciate that. So just to everyone watching, if you have any questions for Nick, if you can please put those into the Q&A. And while we're just waiting on that, Nick, I'm just curious. I love these living guidelines, the idea that it's being, updated more regularly, as opposed to having to wait, years and years before we have the update. But I was just curious. I don't see kids, but in terms of the one, the idea of kids not missing more than 1 week of school, what was the like generally, how long were kids missing? Or was
Yeah,
it all over the place?
it's a great question. And I think, yeah, I think it is a little bit all over the place, but I think traditionally we did have a lot of this: don't engage in life until your concussion symptoms have resolved, right? And
Mm-hmm.
meaning no more headaches, no more anxiety, no more decreased attention. And I think what we've learned, I think both anecdotally in clinical spaces and just being around people with concussion, or just people in general, but also the research has really taken a closer look at this, is that this idea of feeling perfectly well is a fantasy, right? We don't ever feel perfectly well. We all have a lot of symptoms that could be concussion type symptoms. They're not specific to concussion, being headaches and fatigue and so on. So this idea of holding young people to the standard of feeling amazing before they re-engage in something as important as school was something that we really felt strongly that we have to get away from. And we also have some great research that's been done that shows that when we look at groups of kids who have been prescribed re-engagement in activity versus this more traditional rest approach, that those who are re-engaging activity in a way that, that they're being told to is much more beneficial to resolving those post-concussion symptoms and getting back to life sooner. And the school environment is no different, right? The caveat there, though, again, is we can't just take that recommendation and say, we don't want you at home for longer than a week. You need to get back into school, and just throw a young person in the school environment and not provide those accommodations and support in that school environment that are going to be essential for that recovery. So, we need to be careful with the messaging. Yes, we want young people back in the school environment, but it's only helpful if they're in that school environment with great supports from the school, from their healthcare team, from their family, and from their friends. And we have accommodations in place that are going to be useful for them to gradually get back to full activities. That's a really important piece, and we need to all work together to make that happen.
Yeah, for sure. No, that makes a lot of sense. Looks like we have a very quiet group tonight. Must have been a
Well,
long day.
yeah, well, I'll just, again, I'll reiterate, there's a whole lot of links in that presentation, and I encourage you to take a look at them. If you haven't looked at some of
Yeah.
them yet, please do. And also this week is a really great week to find out more information on concussion. Again, that hashtag Concussion Awareness Week on all the social media channels, as well as tomorrow, hashtag Rowans Law Day. There's going to be a lot of great resources being shared and great advice. So I encourage you to take a look at that.
Yeah, for sure. And we do have a question. Nick, I noticed that you said 1 to 2 days of full rest for kids after concussion. This is different than relative rest, which includes ADL and light intensity activity within 24 hours of a concussion, including immediately after concussion, which is now part of the sixth consensus uh, statement. Did I mishear you, or does the PEDS concussion group differ from the sixth consensus um, statement on this issue?
Great, thank you for that, and great to see you on here. I really appreciate all you do at the Concussion Alliance. It's fantastic work. So check that out if people haven't already. Um, yeah, great question and great pickup there. I think this idea of relative rest is really important. And when we're mentioning complete rest, we're not saying bedroom jail, not allowed to do anything. It's what's tolerated. But what we want to not do is two things on both ends of this time limit of 24 to 48 hours. We don't want to be doing too much in the early days post-injury. So we don't want to be, opening up the floodgates so much that we're, doing so much that our symptoms are getting a whole lot worse. And then we also don't want to be doing too little for too long beyond that 48-hour time frame. So to be more direct with my answer, I think, yes, we would agree that we aren't shutting down completely and absolutely doing nothing in that 24 to 48 hours. But we are sort of staying in that home environment, treating it as if, like we had a flu or a bug or something where we just don't have the energy to get out there and do things. We want to give that brain and body a chance to really recover in those early days. It's going to be really important.
Great, thank you very much. And we have another question. How much exercise should kids take or do after concussion?
Yeah, great question. And I think what we're learning from the literature, at least in kids right now, and perhaps arguing in adults as well, is that exercise is one of our best treatment modalities, our best medicine right now for managing concussion. Some excellent research being done by lots of great folks, just highlighting Roger Zemek's work around re-engaging in physical activity and exercise. And I think when it comes to how much should kids be doing, again, outside of that 48-hour time frame, we can start to gradually reintroduce that exercise. And this could be a daily walk, sort of 10 minutes, 15 minutes, keeping the heart rate low, not sort of going too hard, and also listening to our body, right? So if we're doing that daily exercise, if our symptoms are getting a lot worse, then maybe that's our body saying, let's maybe not do that right now. And I'll also speak to the environmental component. If we are doing some exercise in the early days and gradually building up more in our concussion recovery, we want to make sure we're doing that exercise in very predictable environments. Meaning, we don't want to be walking around a track where there's footballs flying around, you could get hit in the head or something like that. We want to make sure that we are eliminating the risk for re-injury in those early days when we're symptomatic and re-engaging in exercise. This is a big part when we think about the school environment and phys ed class and sort of re-engaging in physical activity. And I get this question a lot from phys ed teachers or from parents and kids themselves around, well, is it okay to go back to gym class? Well, I think in the early days, we need to really evaluate what is that activity? What are the risks involved? And if there's any risk involved of being injured again, then it's not the right activity to be re-engaging in at this stage of recovery. And we want to be doing some more isolated, maybe with a friend or two, gentle aerobic activities where we eliminate that risk of being hurt again.
Great, thank you. The next question we have, I'm 44 years old and I have many post-concussion symptoms for the past 6 years. I try to exercise daily. What could be the reason why, when I finish doing any kind of exercise, I feel sleepy?
Yeah, I think, that's a really great question. And I'm sure, that you're not alone in this experience. I think there's probably lots of reasons for that. I think certainly something to discuss with your family doctor around just sort of, when we think about the biopsychosocial, again, all the different components to sort of feeling well after any activity, there could be some biological reasons. So just sort of like fatigue and physiologically. There could be that sort of environments that you're doing the activities in. Maybe you're using more cognitive resources in some environments than others, and your tank's a little more empty. So maybe changing the environment that we do the exercise in. Another thing is thinking about times of day and when we're exercising, right? So, sort of reflecting on what times of day do we feel our best? Do we have the most energy? And what times of day do we tend to feel the worst or have the least amount of energy? And maybe if exercise is a priority for us, we try to schedule that exercise as best we can during those times when we feel really well. So answering exactly the question around, why might you feel sleepy is a bit challenging to know all the different factors. But I think it's certainly, if it's something that you're really motivated to continue to engage in the exercise, which I think is extremely important, and having this sleepy feeling is something that frustrates you or maybe gets in the way of other functional activities, definitely something to bring up with your medical provider and broader health team, because that should be a goal and a functional activity that you really look forward to and you benefit from.
Great. Thank you very much. We have another question. What can you do if you can't remember things after 6 months? I'm assuming this is 6 months after a concussion and you're having some memory issues.
Yeah, so when it comes to concussion, memory issues can be a common experience, and that's something that, my recommendation here is to really bring this up with your medical provider. I think that's going to be really important to explore the different factors and as well the functional impact of this. How is this gap in memory or challenges with memory really impacting your daily life, and what are the challenges with that? And I think with some good assessment from a broader medical team, I think there really are some ways to explore that and to come up with some strategies to improve daily function and to make you feel a little more supported in that. So that would be my recommendation. This is something that is quite common in concussion, memory concerns and difficulty, and it can have a big impact on daily life. And having a good, honest discussion with your medical provider and extending referrals and other supports to a broader medical team that can support specifically with this is going to be really important.
Great. Thank you so much. I think that almost brings us to the end. Oh, wait a minute. We have another one here. Just to go back to my question, this is Malaya. Do you see pediatric guidelines as somewhat different than young adults or adults with regard to exercise in that first 24 to 48 hours? The sixth consensus refers to science, um, referring to Letty's work with college athletes, that shows that physical activity in the first 24 to 48 hours after concussion reduces the risk of symptoms persisting longer than a month. But P.E.T.S concussion is recommending rest as if one had the flu in that time period.
Yeah, yeah. Well, I think it is going to be important to, obviously it's going to be individual for young people or anyone that has a concussion. But I do think physiologically there is some value in making sure we're not overdoing it in the early days. And, particularly, a lot of this work has been, when we're thinking about return to activity, a lot of it has been coming from the sport community, where if we're opening up the window a little bit or cracking the door a little bit to re-engage in sport, then people go for it, right? And they train very, very hard. And I think that could be detrimental. So I think all in moderation. I think if people are feeling quite well after their concussion and they trial some light, short burst aerobic activity, walking and so on in predictable, safe environments, and they're doing quite well with that, then that's a sign from the brain and body that this is an activity that you can handle right now. So, I think it's going to be challenging if we think of it in sort of a complete scenario that everyone 24 to 48 hours complete rest. Some people may really need that, and they may really want that because their body just isn't ready to move again. But I think trial and error in the early days in a really safe way is totally appropriate. And yes, the evidence is pointing towards light aerobic exercise as something that can be really valuable even in the early days post concussion.
Great. Thanks so much, Nick. And thank you for Malaya. I think we're almost at the end. I actually just have a question more, I guess, on the knowledge translation side, in terms of, the family doctors and the people that are actually seeing the kids that may come in and have just been diagnosed and then giving these recommendations. I'm just curious how you're getting this out, and I suppose to the schools as well, so that everyone's sort of on the same page.
Yeah, and that's part of the challenge, but also part of the fun. I think it's one thing creating these recommendations, reviewing the literature, working with amazing experts across North America on the language and how we deliver this. It's a whole nother area to implement, right? And to
Mm-hmm.
really get the word out. And I think, we lean heavily on our networks and our experts across North America to share this information as broadly as we possibly can. We use social media, we use events like this. So it's one thing to get the word out. We need to make sure people even know that these tools exist. And then
Yeah.
we need to work with end users and get great feedback all along the way. And we're always open to any feedback or thoughts around this. And we have some intentional exercises to do this as well, with some interviews and qualitative opportunities to really engage the end user in the process to figure out the pathways to actually bring these to life, right? And I think
Mm-hmm.
a big challenge to that is every context can be quite different. So there's going to be contextual factors that are going to be some barriers possibly to implementation. But I think it's our job as people in this space who are excited about this and want to help as many young people or anyone with a concussion as possible to really challenge ourselves to think about how is this work? How are these tools actually going to be used? And continue to work with end users to ensure that they can be brought to life and be used in the way that they're created to be used, right? To help.
Mm-hmm. Mm-hmm.
So we need to keep working on that. And I'll be totally honest that implementation is the hardest part of this, I think. But I think by putting our heads together and working with great people across the world on how to share this information best and getting true, valuable, honest feedback from end users and acting on that feedback is going to be our best way forward.
That's great. Thank you so much. Well, I think that pretty much brings us right to time. So thank you again for a really great presentation, and for answering all of these questions. And thank you to everyone that attended tonight. Just so you know, there will be a short survey coming your way. And if you've got 2 minutes and you can just provide a bit of feedback for us, that would be really helpful for us moving forward. And just to let you know, we'll be back again in 2 weeks on October the 10th, and we're going to have doctors Carmela Tartaglia and Sharmati Lawton speaking on management of insurance issues in concussion. So thanks again, and hope everyone has a good evening. Take care.
Thanks, everyone. Really appreciate the opportunity, Leslie, and thanks for joining all. And please raise some awareness tomorrow on Rowans Law Day. Let's all get on social media and tell everyone in our network the importance of concussion. Thank you.